My name is Brian Freeman and I'm head of spinal surgery at the Royal Adelaide Hospital. Well, the spine in general, but a subset is spinal cord injury, and that's a passion of mine. I've been doing a lot of research and meeting a lot of patients with spinal cord injury. Really, it's the concept of how much impact someone who suffers a spinal cord injury. It's huge in terms of, and these are, young people, and the impact is unbelievable. There is a subtle change now. We're seeing more and more incomplete cord injuries, whereas before there were a lot of complete cord injury and there was no function in them at all. So there has been some improvement over the last 5 years, I guess. The one thing is time, and if you have someone in remote, South Australia, hours and hours away from a hospital, the chances of them getting any recovery is very low. Whereas if someone has an accident outside here and they come into the hospital and with the same type of injury, they would get into surgery very quickly. And ideally what we're pushing for is an 8-hour window. So from when the cord injury occurs, they need to get into the operating theatre within 8 hours. And that time is spine, if you want to say that. And we're now seeing a lot more incomplete cord injuries, where 10 years ago there were many completes with no function, high function on ventilators. So it's a big jump really about the two. The SPEED trial is the teaching to paramedics about how to assess whether this person has a cord injury, yes or no, and what level is it at, what the sensory level is, what the motor level is. And it's a fairly straightforward 2 to 3 minutes assessment. It's very quick and they're very accurate. When they ring you, it's now, they're almost on equality with me and other spinal consultants, and they're very accurate now. So they've all been trained. 600 of them have had training within South Australia. It'll make a huge difference, I think, in the long term. Some of the other studies, Riluzole, this is a study that we did in conjunction with North America. Again, I was the CI for that, and we're still waiting on the statistics about they've broken down the active drug and then the placebo. And so we're waiting on those. There's 193 patients recruited in that study, and we've got another one coming up called a treatment, Elizazumab is another drug that's taking a different approach, but again it's trying to protect the spinal cord and enhance normal function in some parts of the spinal cord. It's a study looking at magnetic resonance imaging, or MRI scan, versus PET-CT, and that's a positron emission tomography machine, and it does need an isotope that you inject into the patient's arm, and then when you compare the MRI scan versus the PET-CT, you can see whether the spinal cord has function. I've been doing this type of work for 12 years, and we've published a lot of papers, and the one thing that jumps out as being a significant and straightforward procedure is to get within 12 hours, 8-12 hours, then there's a good chance there'll be recovery. It's, I think we've got lots of studies ongoing, but I think that's the thing that we run with at the moment. And we've collected all the the details of those times and things. So we're now getting quite a significant number of patients, and you can easily see what's happening. So it's the number one thing I think we need to do, apart from prevention, of course. Young males are. I was one once, but obviously, the prevention really should be with young men who take risks. They drive too quickly. They go swimming. They dive off a bridge, and and they have. You hardly see any cord injuries in females in that 18 to 20 group, because women are much more sensible, I think. Well, we have 7 spinal cord centres within Australia, and we have 2 in New Zealand, and those were all the ones that contributed their data, and that's where we got some really good papers at a high level. So, and they're often. We do talk to each other. I mean, we often have, subspecialties in spinal cord injury, and we're all discussing, what's the latest thing, what can we do, and working together in other teams within other states and territories. And that's we're looking at 250 to 300 spinal cord injuries per year. So it's not reducing, unfortunately. So prevention might be a good thing to do.